What is the state of the longevity market today? Welcome to What's Next Canada, Canada's premier aging and brain health conference, repurposed for you in a special podcast series. Listen in with our host, Dr. Alison Secular, as she introduces the keynote speaker, Dr. Jean Accius, Senior Vice President of AARP Global Thought Leadership. Here we go. Now streaming, listen in to this keynote speech entitled The Longevity Economy Outlook.
And now I would like to introduce our keynote speaker, Dr. Jean Accius. Dr. Accius is the Senior Vice President, AARP Global Thought Leadership, and he's a nationally recognized thought leader on aging, longevity, health, and long-term care policy. And he's also a tri-sector leader with deep knowledge and a wealth of experience, having served in senior level positions across private, public, and nonprofit sectors. He's also frequently seen in media outlets, including Time Magazine, USA Today, Reuters, Politico, Huffington Post, and so on. And he also has received many, many awards, including recently having been recognized as one of Black Enterprise Magazine's 2018 Modern Man of Distinction, and a recipient of Prince George's County Social Innovation Fund 40 Under 40 Award, as well as being recognized as a Gerontological Society of American Fellow. And we're honored to have him with us today, and so I will pass it on to our keynote speaker.
Well, thank you so much, Allison. Can everyone hear me?
We can hear you, Jean. Thank you. You can launch your video if you wish, and we've got your slides on the screen.
Absolutely. Well, first of all, I just want to say thank you so much to the organizers, to Allison and Mel, and many of you for joining today. I'm excited that we were able to utilize technology to continue what I think is a very critical and important conversation. And that's really around how can we lead global change to really better the lives of older adults and their families, not just today, but also in the future. So I would like to kick off our conversation today, and I really want this to be a conversation. So who are we? AARP was born and founded in 1958 by a retired principal who went looking to find her retired friend who was a retired teacher, and eventually found her actually living in a chicken coop, literally a shack without any walls. And outraged by that, she used that energy to start an idea. And that idea would actually change the lives of millions of people. So AARP, for those who are not familiar with us as an organization, we're a social mission organization with a membership of over 38 million people. We empower people to choose how they live as they age. And going back to our founder, Dr. Ethel Percy Andrews, who was also a caregiver for her mom and was volunteering for the California Retired Teachers Association, she really took into her call to action, if you will, the opportunities to really think about ways to create innovative products and services to really help meet the needs of older adults. Again, going back to the chicken coop situation. You see, back in those days, health insurance typically expired when folks turned 65. So this was pre-Medicare days. And the combination of health insurance, inflation, and rising healthcare costs meant that a chicken coop was all her retired friend could actually afford. Ethel was moved with the empathy and the emotion that came with actually seeing her retired friend in a chicken coop, that she had a radical idea. And that radical idea was to create a group health insurance for retired teachers that could stay with them beyond the age of 65. Then she got organized. She formed the National Retired Teachers Association, linking the various state retired teacher organizations under one umbrella, and proceeded to knock on doors of over 40 insurance companies with her idea. Most laughed, as you could imagine, until one agreed to test the idea. They created not just the first ever group health insurance plan in the history of the United States, but one that was truly world-class with features like no medical exam requirements. All pre-existing conditions were covered, and there were no required plan exclusivity and coverage anywhere in the world. So what started off as a situation where she found her retired friend living in a chicken coop birthed into an idea. That idea birthed into some form of innovation that really started not just a movement, but also to drive systemic change, both in terms of the healthcare coverage that was being delivered in the United States. So AARP, as a social mission organization, was truly founded on the idea of innovation. It is part of who we are, it's a part of our DNA, and it is what we've been doing for over more than 60 years. As we think about the current trends, both in terms of where we are today, particularly in the US, but also globally, what we're seeing is the fact that we're all aging, that the number of people over the age of 60 globally outnumber the number of children under the age of 5. And not only are we aging, but the ability to live longer and healthier lives is one of mankind or humankind's greatest accomplishments. But we also know that there's great variation in terms of exactly who's benefiting from the increase in life expectancy. As I mentioned before, that the aging revolution is currently taking place around the world. People are living longer, healthier, and productive lives. And unlike other micro shifts that are reshaping our world, like climate change, for example, no one is debating whether the shift to the older global population really exists. And what this slide shows you is exactly in 2015, Japan became the first country with more than a quarter of its population age 65. And then by 2050, what you will see on this slide is the number of countries that will also reach that marker. So again, the population is aging, and it's not just happening within the borders of the United States or Canada, but this is a global phenomenon. The research has indicated that a child born today has a 50% chance of living to 100, or at least 104, beyond 100. And there's some researchers who indicate that the first person to live to 150 years old is actually alive today. So that could potentially be one of you who's participating on the call today. So we have an opportunity to think about the fact that, particularly in the US, that 10,000 people are turning 65 each and every day. In just a couple of years, the number of older adults in this country will exceed the number of children under the age of 18. The fastest aging age group is those who are over the age of 85. And you heard from Allison some of the markers with that. That could be increased need for long-term care or long-term services and supports. It could also mean the increased prevalence potentially of dementia. So there are key markers that comes with this age group that we need to think about. The second fastest age group are people over the age of 100. So we're not just getting older, as again, we're living longer. With that, what we need to think about, and I did this specifically with the intro video, is exactly to kind of think about if indeed we are living longer, what does that mean from an innovation standpoint for developing solutions and products to meet the needs of an aging population? What does it mean in terms of the current models we currently have in place, whether that is work, whether that is our education system, whether that is the form of technology, whether it's the communities in which we live in? What does that mean in terms of the current models and the disruption that might need to take place in order to align with a longer and hopefully healthier life? What does it mean in terms of the fact that many people are living non-linear lives, but the current models we have in place are linear in nature? And what do I mean by this? Well, let's take education, for example. In the United States, the current model is that you go through you go through high school and hopefully college, and then you work for 40, 50 years, and then quote unquote you retire. Well, the fact that people are living longer, the need to either work or either because they want to or because they need to is going to increase. And when we kind of think about the model of the skill sets, we need to kind of think along the lines of lifelong learning, meaning the fact that education can no longer be an episodic event that occurs in an earlier stage in our life, but we always have to continue to kind of think about opportunities for upskilling and reskilling. So this basically shows you the fact that the number of workers aged 50 and older in the US has increased 80% over the last 20 years. And that's more than 4 times faster than the overall workforce. So again, people are living longer. working longer. And we recently conducted a survey with major global companies, about 1,700 global companies, just to gauge exactly what does this actually mean and what are some of the opportunities and challenges that they may be experiencing. And what they indicated to us, and this was C-suite executives, major CEOs, and as well as executives, global companies from OECD countries, what they indicated is the fact that we have an opportunity to really foster a multi-generational workforce. And if we can actually tap into that opportunity, it would actually increase our GDP rather than see a decline. So the cost of doing nothing, particularly in OECD countries with regards to an aging population and an increase in terms of the workforce, would impact economic growth. But the opportunity to actually tap into this presents a tremendous opportunity in terms of overall economic prosperity for these OECD countries. So with that, we wanted to just kind of share with you a major initiative that we're doing within AARP, and it's a major partnership between the World Economic Forum, AARP, and OECD. And what we have here is the fact that it's called Living, Learning, and Earning Longer. And it's an opportunity to really bring global companies together to talk about ways in which we can create, invest, and ensure some prosperity, both for employers and employees in this new age of longevity, in this new age of innovation, and in this new age where we have to re-examine our current models. And this is an opportunity for any global companies to sign up and join this learning collaborative. It's peer-to-peer. We provide a range of convening and networking opportunities for companies to engage with other global companies around leveraging and fostering a multi-generational workforce. So I can say more about that during the Q&A. So what does all this mean? So we just recently released a major report called the Longevity Economy Outlook. And this really is designed to highlight the economic contributions of the growing 50-plus market, particularly in the US. And what we found was the fact that when you look at the economic contributions of the 50-plus population in the US, it's over $8.3 trillion. And I do want to say a couple of things about why we actually do this study. One key aspect is that we want to demonstrate really the opportunity that comes with an aging population, that this is a population that wants to and would like to contribute and be of value both to society, as well as in terms of thinking about what are the market opportunities for the development of products and services to meet their growing needs. We want to disrupt this narrative that older adults are a liability, that they're a decline, and really talk about, look at the tremendous opportunity that the older adult population, particularly in the US, contributes to the GDP. And if you were to kind of capture exactly this $8.3 trillion dollar number in terms of where it would rank, what you find is the fact that if the 50-plus population in the US was its own country, it would rank third after the US and China. So this is a huge opportunity, not just today, but I'm also going to talk about exactly in the future. With this study, and we can get you the link to this report, what we were able to do is also do the projections between now and 2050. And this is critically important in part because of the fact that what we found from this major outlook report is the fact that not only is the 50 plus contributing to the economy, but they're also contributing to the prosperity of all generations. And when you look at this 10, 20 years down the line, what you find is the fact that millennials today will turn 50 in 2031, and Gen Z will turn 50 in 2042. So if you take that into account, what you find is the fact that the growth opportunity goes from 8.3 trillion in 2018 to over $28 trillion in 2050. So you see a significant amount of growth, particularly with regards to the contributions of the 50-plus population. And this is benefiting all sectors across the economy, all industries, and you'll find this in the report that all industries, all sectors have an opportunity to really benefit from what the economic contributions of the 50 plus actually is doing. In terms of dollars, another way to kind of look at this would be if for every dollar that's spent in the US, 56 cents of every dollar in 2018 was spent by the people over the age of 50 and older. In addition to that, because we're able to do the projections to 2050, what you find is the fact that 61%, another way to look at it is 61 cents of every dollar in the US will be spent by someone over the age of 50. Again, that is a growth opportunity and something that we really need to think about as we leverage the economic contributions of this growing, aging population. So that's all great news, but I also want to be realistic about the opportunities before us, that life is complex and it consistently evolves. And as we talk about the fact that we're seeing people live longer, we also need to recognize that there is great variation and disparities in terms of life expectancy. And the other thing is that whether or not life expectancy is the critical marker. And what I mean by that is we did a range of conversations across the country many years ago, and we posed this question to consumers. We said, would you want to live to 100? And I'm going to stop here and just throw that question out to all of you for you to kind of think about. Would you want to live to 100? And as you think about that question, I'll share with you what some of the comments we received from a lot of the consumers we spoke to. They said, it depends. It depends what my quality of life would be. Living to 100 or beyond 100, if it means that it's not productive, if it means that my needs are not being met, if it means that my preferences are not being valued, if it means that my quality of life would be on the decline, then potentially no. So one of the things that we wanted to do is really kind of shift the conversation from lifespan to health span. And what we mean by health span is like, what is the quality of your life given these added years? And how can we embrace the gift with these extra years of life? So global life expectancy was 73 years, and health life expectancy was only 63 years. So again, health life expectancy is the number of years that a person at any given age can expect to live in a full, healthy life, taking into account disability and mortality. So it's not just lifespan, it's also health span. And as we have this conversation today, as we think about innovation, and as we think about opportunities to leverage the aging of the population to meet their needs and also to support their families, we also have to think about what are the innovations we're creating to really ensure that people can live a dignified life as they define it. Again, this just shows you the disparities that exist. And as we think about innovation, it's critically important that we be cognizant and intentional about the opportunities to create solutions that meets the needs of the vast majority of the population, given the disparities that currently exist in terms of life expectancy. But there's opportunities to stimulate the aging market. Longer life requires that we shift the way we live today. At AARP, in order to stimulate the private industry, we created an AARP Innovation Fund with JP Morgan. And the goal was to really invest in innovative products and services, focus on improving the lives of people over the age of 50, as well as supporting their families. We thought that it was critically important that as an organization that we could work with our innovation team and work with private industry and startups to really kind of think about what are those solutions that can meet the needs of an aging population. So again, there's the opportunities, but there's also some of the realities that come with what people are trying to manage on a day-to-day basis, and how can we do that in a very intentional and strategic way. So we have a fund that's $40 million that we started many years ago with JP Morgan, and we've invested looking at 3 areas of focus, particularly that's health related. One is around aging at home. We know from a lot of our surveys that the vast majority of people would prefer to receive services in their homes and communities for as long as possible. So one of the areas that we wanted to focus on as an organization is what are the innovative solutions that are being developed in private industry that would allow individuals to really age at home for as long as possible. The second was around convenience and access to healthcare. And what this looks at is the advancements of products and services that support and empower people over the age of 50 to adopt positive, healthy behaviors. And this can include things like telemedicine, consumer diagnostics, and consumer care transparency tools. And then the third area is around preventative health. So this is the expansion of the market for products and services that help people over the age of 50 prevent the onset of serious health conditions. And that could be either through diet and nutrition management, stress and emotional management therapy, fitness apps and programs, and integrated health engagement incentives, as well as cognitive and brain health would fall into that bucket. And I just wanted to kind of share with you some of the companies that we've actually invested in so far. In addition to our innovation fund, we invested as part of our 60th year anniversary, $60 million in what we're referring to as AARP's Brain Health Fund, which is investing $60 million in the Dementia Discovery Fund to invest in research and development of breakthrough treatments for dementia, including Alzheimer's disease. We also have our Global Council for Brain Health that's focused on not just research, but also looking at ways in which we can address quality of life and quality of care issues, particularly for individuals that have dementia, and also their family members who's providing that type of care. So the Dementia Discovery Fund, as some of you may know, the goal is to raise awareness of dementia-related illnesses. In our case, is to educate people over the age of 50 and older and their caregivers about how to maintain a healthy brain health while supporting those who are suffering from dementia. And of course, to find better treatments in cooperation with researchers, public health agencies, as well as investors. So with that, I would just stop and say, we would like you to join us in terms of challenging outdated beliefs, both in terms of exactly the perception and view and value of what it means to get older, not just in the US, but globally. And how can we tap the wisdom, the insights, the desire among older adults to be a contributor, both economically as well as through unpaid activities like caregiving and volunteering. The outcome that we seek is really to ensure that more people can choose how they live and age. And we want to do that by sparking new solutions. So with that, I will stop and turn it back to all of you.
Thank you very much, Jean. Jean, we're going to have Mary Furlong join in now. Jean, I think she has dropped off, so we are going to just move into a few questions that we have. We already have a few questions coming in.
Right.
Here we go. Jean, how would you advise employers to make their workplaces more age diverse? What kind of practical tips would you have?
That is a great question. Part of what we're doing with the Learning Collaborative is exploring what are some of the promising practices. And I'm going to try to start my video so you can actually see me. There you go. So what we're doing is working very closely with major companies as part of our global collaborative efforts to really identify and amplify what are some of these promising practices. As part of our major effort around creating a more age-diverse workforce, we hosted a series of global regional meetings, one in New York back in July of last year. In September of last year, we were in Singapore, and then we were in Paris in October of last year, and in total engaging over 100 C-suite executives from 7 different industries. And there are a couple of things that we've heard so far from a lot of these companies that we think are promising practices, and we have some here at AARP. One is to think about the opportunities for creating benefits that are quote unquote ageless. And what I mean by that is the fact that are there opportunities to think beyond a certain segment of your workforce population that might benefit from some type of benefit. And an example of that would be in the case of caregiving. We know that that there are, particularly in the U.S., there's over 41 million family caregivers in the U.S. And the average age is someone or a woman over the age of 45 or 46, to be a little bit more exact. Caregiving, while it can be rewarding, I think for many people who've been caregivers, and what the research shows is the fact that caregiving can also be tough. Many caregivers are juggling between their work as well as providing caregiving. And then, of course, in many cases, they might be part of the sandwich generation. So a good example of a benefit that might be ageless is caregiving leave, and one that recognizes that there is going to be some older adults in your workforce that are caregivers, but there's also a likelihood, and the data shows that 1 in 4 or 25% of all caregivers are millennials. So thinking about exactly what are some of the benefits that is being offered. The other thing that we know that a lot of companies are doing, they're getting away from some of their recruitment tools, some of the language that's used, looking for a young, creative, and energized candidate is just one example, right? What's the language that's actually being used to advertise for positions? And how might that signal to the broader marketplace, as well as your workers, that you're looking for a certain segment of the population? Another example is to move away from graduation dates and salary histories. Research has shown that when you ask for salary histories, not only does it disproportionately impact potentially older adults, but it also disproportionately impact women. So there's that gender lens as well. I will say that many of the practices that, if we were to go back to one of the slides I talked about, many companies are thinking about how can they create a culture that is more age diverse. The opportunities for mentorship. There's a lot of commonalities, frankly, between boomers and millennials. Most want flexibility. What they do with that flexibility might vary depending on their life stage. So what are the opportunities to really kind of think about an environment that fosters greater flexibility? In terms of investing, how are we investing in the current workforce, both in terms of lifelong learning? When we kind of think about tuition reimbursement, is that only being, is that a benefit that's offered to the entire workforce, or is there a specific group that's being targeted for that opportunity, as well as upskilling? So how can we create an environment as a company to really foster an age diverse workforce? Opportunities for mentorship is another example. Where Morgan Stanley, they mentioned that in their workforce, they actually have what they refer to as a returnship program, meaning the fact that people who actually exited the workforce or left the company can return and work part-time and volunteer, mentor, what I mean by volunteer. Hartford is another company where they have, as part of their employee resource groups, they have one that's called the YoPro, and another research group that is called GrowPro. And that's basically two SSRGs, employee strategic resource groups, that come together to talk about what they're going through from a generational standpoint, as well as the opportunities to foster an environment that's more age diverse, inclusive. Finally, I will just say this because I see Mel giving me the hand here. I will say this, that PwC actually did some research, and they found that only 8% of companies included age as part of their diversity and inclusion policies. So one of the things that we're doing as an organization through the Living, Learning, Earning Longer initiative is really to foster an opportunity with these global companies to increase age diversity, particularly as part of their D&I policies. And I will say one thing, with the Learning Collaborative, we have over 27 global companies. Our goal is to at least get up to 50. And there's no financial commitment to join. It really is a win-win proposition for companies who are interested in learning about ways to create a more age diverse workforce, and also an opportunity to get access to research and resources in order to do so. And then, of course, there's the wonderful networking opportunities. The 27 global companies come from 7 different industries. And it reflects over 1.4 million employees in total, and close to $1 trillion in annual revenue. So this is a significant opportunity.
Fantastic, Gene. I like your words about the senior population and what they contribute to our workforce. We're going to hear some words later today by Tom Camber from OATS, Older Adults Technology Services, sort of along the same line, reiterating some of those same thoughts and talking a little bit about that, which will be quite interesting. And I also like your words about the sandwich generation. I've heard people also call us now in what we call the double-decker sandwich generation.
Exactly.
Got a couple more questions here, but I do want to see if Mary Furlong, I think you might be in by phone now. Mary, are you there? With Mary, I'll have our tech team try to work on that. But in the meantime, I do have another question for you, Gene. What are some of the innovative technologies having the biggest impact on aging well? Maybe some of the ones from the hatchery and others you'd like to highlight.
Right. No, that is a great question. One of the things we identified early on, so we released the Longevity Economy Outlook report back in December, and was at CES earlier in the year. And one of the areas where we think there's a significant amount of opportunity is in the technology space. And what I mean by that is the fact that currently people over the age of 50 spend roughly about $140 billion on technology in 2018. By 2050, it would have gone up to $645 billion. One of the fastest growth areas is in technology. So for people over the age of 50, when you look at the report that we released, supported over 850,000 jobs and provided roughly about $113 billion worth of wages and salaries toward the technology sector. So there's a tremendous amount of opportunity in terms of technology to really help individuals age and live with options and to support them in the process. As Mel was referring to, we have our innovation lab, and our innovation lab is designed to really work very closely with a range of different startups and companies around solutions to meet the needs of an aging population. I'm not going to pick out a particular technology, in part because of the fact that I want to play favorites, but I do think that there's a lot of opportunity in the technology space to meet the needs of an aging population, especially one that's living much longer and really want to age with options. How about that, Mel?
That's fantastic. That's fantastic. Thank you very much, Gene. I'm going to try one more time to see if Mary's on, but I don't think she is, so I apologize. Gene, thank you very much for taking the time to speak with us. And we had some discussions late last week about this having to go virtual, and I appreciate you were one of the first to put up your hand and say whatever it needs to take place, that you were the first to put up your hand and say, I'm there virtually to continue with this keynote address. And we really appreciate that. And we appreciate how we've started to work with you and met you in Washington back in December, and look forward to how ARP is expanding its reach internationally. And thank you for your kind words today, and we look forward to working together very closely in the very near future.
Well, thank you so much, Mel, and thank you to all of you. We will be sure to share many of the resources that I talked about today. Again, I really do think that this is a wonderful opportunity, particularly within the next 10 years, given many of the trends that are occurring, particularly with the aging of the population, where we can really amplify and spark some new solutions to ensure that people can age with options.
Fantastic. Thank you so much, Gene. I'm going to give you a virtual handshake, which is the way we're doing handshakes these days. And,
thank you.
High five. And
the Center for Aging and Brain Health Innovation is powered by Baycrest. To listen in and get involved, go to CABHI.com. The podcast technicians behind the scenes are Podtex. Share your What's Next Canada podcast ideas with us at www.podtex.com. Poddex, your partners in podcasting.